Hello everyone, welcome to Medication Administration Training. First, we'd like to welcome you to Mains'l Services. Thank you for being here and being a part of the important work and supporting people to live a life of their choosing in their own homes. So today, what we'd like to do is we would really like to introduce you to the medication certification process. We'll then go into what your responsibilities are while in the home passing medications. We'll introduce you to what MARS stands for, in addition to giving you a brief overview of different medication types and what you may see while working in the homes. One of the most important things when passing medication are the 7 rights of medication administration. We will show a short video going over exactly what those 7 rights are and what they mean. And lastly, we'll go over some medical policies, procedures, and practices, so that way you're clear on what is expected of you when working at Mains'l and in the homes. So the purpose of today is to truly, at the end of the day, understand how to successfully support people with their medication needs. We also want to identify what concerns may arise when passing medications and how you can go about communicating those concerns and who to contact when. And as I said before, we will review the Mains'l practices and protocols throughout the training. This is a self-paced training. It is an introductory course. Your manager will follow up with giving you hands-on training in the house after you complete this training. What a self-paced training means is that at any time you can pause this training, you may rewind. If anything is unclear or you have questions, please do not hesitate to rewind or to stop the training and call your manager for clarification. You cannot skip ahead. You will have to watch the entirety of this training. And then at the end of the training, there will be a quiz that we ask you to complete. If you get an answer wrong, don't worry. We will give you the answer and your manager will review that with you. Before we start any training, we really want to identify what are your core responsibilities as an employee when delivering medications. And a core responsibility means that this is the expectation of you that you get right. And if there are any errors, that you communicate that to your manager immediately. So let's take a look at some of your responsibilities. The first one is constant communication with your manager. Your manager is your support system as well as your peers. But please be in constant communication with them. If there's any questions, possible mistakes, or any changes in behaviors or medication, we do expect that you contact your manager or the on-call manager. It is also your responsibility to follow all guidelines and directives. Medications are critically important to people's health. It is required of you to follow those orders so that way we can ensure the safety of others. And we would also like it if you could have a basic understanding of what medications you are administering and why. Each person in the home that you're going to be working with may have different medications, different PRNs. It will only benefit you and the people in the house if you have an understanding of why they're taking the medication so you can successfully support them. When we're looking at medication administration responsibilities, we do ask that you start each shift looking at your electronic medication administration record. I know that's a mouthful, but we call it EMARS. So remember, EMARS stands for Electronic Medication Administration Record. That is where all the medication, the dosage, the time is going to be documented. It's important that you check that at the beginning of each shift, so that way you are aware of any changes in medication, if someone needed a PRN, and you have the understanding of what is asked of you for each shift. It will also help you identify if there are any errors before going into the shift. We ask that you do not prepare any medications before the scheduled time. There is a window of when you can offer a medication. Again, please do not do that before that window because it increases the opportunity for errors or something to occur. As I said, there's a window. So what is the window? The window is that you have 1 hour before the scheduled time or 1 hour after the scheduled time to administer that medication. Some people that we support really like advance notice. Again, really spend time understanding the person's preference and how they prefer their medication to be delivered and the communication around that. It is imperative that you do not leave any medication unattended at any time. So what do we need to administer medication? As I said earlier, there is the EMARS that will let you know what medications there are, and that is a written order. So Mains'l has received a written order from a pharmacy or a healthcare provider that states which medication that person can take, when they can take it, what dose they should take, and any other information that is pertinent for us to know. If you are ever going with a person to an appointment or looking to reorder medications or have any conversations with a healthcare provider, you must inform Mains'l that there has been a change. As you can see on the screen, our phone number is on there. You also have your manager's phone number as well as the on-call phone number. But please make sure that you communicate if there are any changes asked by the healthcare provider. As we mentioned, the MARS or the EMARS is an essential piece of documentation when looking at medications. We've already identified what is on the MARS, but we also want to ensure that we are constantly looking at what is written on the MARS and what is on the prescription label. So again, one of your core responsibilities will to ensure that the MARS and the prescription label do match. At any time the medication is prescribed, we want to make sure that we update the MARS accordingly. Sometimes a pharmacy or the healthcare provider can change the strength of the medication delivered, but we still have medications on hand to use. We will need to make sure that the MARS is reflective of that, so everyone is clear on what dose the person should be receiving. Again, that is the responsibility of your SC, manager, or nurse. You are required to notify your manager if that change is needed so they can update the documentation appropriately. So let's go ahead and look at what type of medications you will see when you are in the home. Again, this is going to be a high-level overview, but a PRN is something that you will hear quite frequently. And what a PRN means is that it is a as-needed medication. This can be an over-the-counter medication or a prescription. It essentially means that it's something that the person is not going to take every day. It is going to be something that is taken as needed. So if the person has a headache or if they need to or want to calm down, you may offer a PRN. Even though it's a PRN, it will still be on the MARS with written instructions on how to give the medication, when to give the medication, and the correct dose. But essentially, just remember it's as needed. And then we have the psychotropic medication. What a psychotropic medication is that it is essentially a mood stabilizing medication, or it can be used to treat mental health. And the manager will provide a written procedure with instructions on how to use the psychotropic medication if it is a PRN. Once again, your manager will go into further detail with you, but please know when we talk about psychotropics, we look at it as a mood stabilizing medication, or it can be used to treat mental health. And then we also have controlled medication. Controlled medication is a Schedule II medication. It can include morphine, opium, codeine. These are very highly addictive medications. It is essential that when you start your shift every day, that you remember to count the amount of controlled medications that are on hand. Do not rely on others to have counted appropriately. You want to ensure that all the medications are accounted for and will want to do that at the beginning of each shift. If there is a controlled medication that does need to be destroyed, you must contact a residential supervisor to come pick that medication up. You can contact your manager, but know that you are not permitted to destroy that medication. It has to be done by a senior leader. Next, we're going to go into the 7 rights of medication administration. There may be times that you are asked to prepackage a person's medication. So if a person is leaving home for a few days, let's say to go on a trip, your manager may ask you to package and prepare their medications for that trip. If you are going to package the medication, please make sure you're putting all the medication for that one time in one envelope. It must be labeled with the person's name, the medication date and time, the medication name and dose. Once again, your manager will be going over this with you in greater detail, but know that it will be something that you may be asked to do in the future. You may also be asked to reorder certain medications. So staff are responsible to reorder medication when there are 7 days remaining. So if you see that a person is running low on their medication, please contact the proper pharmacy or healthcare professional to reorder. You'll also want to make sure that you are not only looking for pills, but you are looking for creams such as toothpaste, refrigerated medication, and insulin. We know that medication errors happen. A medication error is considered anything that revolves around the missed dose of the medication, if you gave it on the wrong date, the wrong time, possibly the wrong medication or the wrong person. Even the wrong route is considered a medication error. If a person refuses to take a medication, it's not an error for you, the employee, but it does need to be reported to Far Northern Regional Center within 24 hours of refusal. You'll also want to notify the manager if the person is not wanting to take the medication. All medication errors must be reported immediately. Every staff is responsible for finding and reporting errors. If you discover a medication error, you are responsible for completing the medication and treatment error form, which is located in the Captain's Quarter in Sandata. Your manager will review this form with you and will support you in filling one out if you have to do so. At Mains'l, we do have a medication error point system. So every time there is a medication error, the employee responsible is given a point. The points are assigned by the type of error. They are accumulated over time until the employee reaches 20 points. If an employee receives 20 points, then they will not be able to pass medication until they receive retraining. Once an employee has received the retraining, they will go back down to 0 points. However, if an employee reaches 20 points for the second time in 1 year, then their medication administration ability may be revoked, and the home management team, which is the senior manager, and HR, will meet to determine further employment options. So that way we can identify proper supports to ensure that medications are being administered properly. If there's ever a time where a medication error occurs or someone is responding poorly to a medication, we want you to know that you do and are responsible for calling the appropriate people. If you feel that is life-threatening or cannot get a hold of people, please call 911. If you believe this is not life-threatening but needs immediate assistance, please call your program manager. If the program manager is not available, or if this is happening in the evening between 6 p.m. and 8 a.m. or on the weekends, please call the on-call manager. Make sure that you leave a message and call back in 15 minutes if they do not respond. If you cannot get a hold of the manager, make sure that you call the on-call physician at the person's primary care clinic. But most importantly, when in doubt, always call. We have supports in place and we want to be there for you. Now that we have reviewed the manager notification procedure, we'd like to discuss another responsibility while supporting people in their homes, which is doctor's appointments. There are different types of appointments. There are in-person appointments and virtual appointments. To demonstrate what is asked of you for the appointments, we've put together a small video that discusses your core responsibilities. If you have any questions regarding what you just saw within the video, please make sure you ask your manager. They are there to support you and again are going to give you hands-on training when you are in the person's home and when these things are occurring. But please remember just to try to prepare in advance, know why you are going to that appointment, bring the necessary paperwork, and make sure that you are requesting an after-visit summary that you can bring home so all staff that are in the person's life can support that person. Thank you so much for your time in this training. We hope that you received a high-level overview of medication administration. Before you go, we will ask you to fill out this final quiz. Once you are done with the quiz, you may log out and contact your manager to let them know this is complete. Thank you very much.